Welcome back to MedEd Matters, your medical education podcast. It is now 2026 for those of you listening or watching. So, Happy New Year. Hope you had a wonderful Christmas, Kwanzaa, Hanukkah, or whatever you're celebrating or not celebrating. I'm your host, Dr. Omar Young. I am joined by my co-host, Dr. Abhishek Sripad. And today we're going to do something a little bit different. So, you guys are accustomed to hearing us interview folks who are really involved in medical education and what it means to be involved in academic medicine. But Dr. Shripad had an interesting idea, and he wanted to interview me. So I am going to shut up, and Dr. Shripad is going to take it over. So it's all you.
Well, great. And welcome everybody to 2026. I'm excited to bring everybody continued great medical education content. And in thinking about that, we had thought about bringing an expert on to discuss our topic for today, which is holistic review. And our very own Dr. Omar Young seemed to be the ideal person to chat about that. And, typically in the co-host role, we don't get to hear all the insights that Dr. Young has. So we thought this would be an excellent opportunity to take a deep dive and also learn a bit more about the founder and host of the podcast. So, Dr.
No
Young, I guess
pressure, no pressure.
I guess we can get started and tell us a little bit about yourself. We know you as an ambassador of medical education, but tell us a little bit about sort of where you've been and your journey in this space.
Yeah. So, when people ask me, like, how did I get involved in medical education, I always think about how did I learn medicine and what it means to be an OBGYN or preventive medicine doc. Um, I really got my fire ignited for this by seeing what shouldn't happen. And so when I was in residency, in particular, I saw examples of what meant to be a less than ideal educator. And that drove me to having a career to saying, I don't want my future residents and fellows to have the experiences that I had, and I want them to leave training being able to practice at the breadth and depth of the specialty at their best ability. So when I was a fellow, I really had an awesome mentor, Dr. Christina Parvianen at McGee, who really inspired me to get involved in medical education, understanding what exactly did that mean? Did that mean administration? Did that mean excelling in clinical teaching? Did that mean research? Did it mean a combination thereof? And so I really got to hone my skills by doing some extra coursework through a certificate program at McGee in medical education. And then my career took off from then. I've really been involved in all aspects of the medical education spectrum, from pre-med to med student, all the way to continuing in medical education with attendings. Um, about a few years ago, one of my colleagues at VCU and we started a program specifically focusing on increasing the number of underrepresented minorities in medicine, and focusing particularly on Black men, as Black men represent only 2% of all the physicians in the United States total. And so we started a Facebook group called Black Men in Medicine, and that has been really inspiring to see folks reach out to us for mentorship on how do I assemble an application for medical school? How do I get into residency? I've talked to people on what is appropriate, how to interview for different positions, and getting them plugged in with different colleagues that I know around the country. So that's been really awesome to do. And now I am, wanting to continue to give back to the medical education community, because I think it really is super important that we really understand what is medical education. And so when I someone asks me what is it, it is the ability to execute clinical care that is going to mitigate harm to those that are most at risk. And so, if you are able to practice medicine that's evidence-based, high value, cost conscious, then you are going to have the largest effect on populations that really deserve care.
That makes a lot of sense, seeing that, how your career has unfolded from the seed of addressing what bothered you the most from earlier in your medical training journey and using that as a fuel to kind of guide how you have shaped your career, which, I think brings us to a natural segue of talking about your interest in our topic today, which is holistic review. And, for those who are new to the topic or, don't know too much, tell us a little bit about what the quick bullet points of, what exactly is holistic review? And for somebody who's in the car with either their kid screaming in the back or has to get out quickly here and what are the two or three takeaways that we'll, double click on here for the remainder of the episode that you really want people to walk away with about what exactly holistic review is?
Yeah. So it's actually timely that we're talking about this now, because if you're watching this episode now, or we are doing this in January of 2026, and this is the time where residency programs are winding down their interview seasons, or they're starting to construct their rank lists. And so in the last few years in the world of med ed, holistic review has become a really hot topic. And what exactly is holistic review is still up for debate in crystallizing exactly what it means. But I think when we talk about holistic review, it's really important that we step back and understand why this aspect exists. So, when you and I were in training, or in the midst of wanting to be in training, you go to med school, you do your first 2 years of coursework. Traditionally, that is, you're in class for umpteen hours, you're taking a block of exams, and then all of that leads to a major exam called step one. And step one basically is what I would think is an interminable quiz on physiology, pathophysiology, bugs, drugs, everything. And when you and I were in school, and you can let me know what your thoughts were, this exam was going to make or break you as a physician in terms of where you would apply, what you would apply in, or if you even were going to be a doctor. I don't know if you had thoughts on about that.
Oh, absolutely. I mean, the decision to go into a certain specialty, not only for that, preceding couple of weeks or months before the exam, was defining of what that looked like and, what you were thinking. But really, the preceding 2 years, if somebody stated they wanted to go into a certain field associated with high scores, required to even get interviews, I mean, that really shapes the entire preceding 2 years as to how you think about somebody studying for their, exams, getting, good grades, good test scores. And it was really like a pre-step one and a post-step one life
Hmm.
when we were going through medical school. There really, of course, every medical school had different versions of preclinical exposure to patient care and all of that, but those were, quick little dabs and, dabbles into that sea. But really, I mean, it was pre and post that test, and
Yeah, and
you couldn't
I
shut
remember.
off that, world until you got there.
Yeah, and I remember, like, after I finished my second year of med school, we got about a good 6 or 7 weeks to study, and I was in the library studying for like 8 to 10 hours a day, all this stuff. It was like, if I didn't do a certain score, then I wasn't going to be able to go into what I wanted to go into. Now, did I know that I was going to do OB/GYN for the rest of my life at that time? Absolutely not. But I wanted to have all of my options open. And so, that was the environment in medical schools. And then residency programs would then use those step one scores as triaging for cutoffs of whether or not they even looked at your application, right? And then, they would use your step one and or your step two scores to determine if you would be given an interview. And then in that interview process, you would, when we were doing things in person, you would meet with faculty, you would meet with residents, you would meet with ancillary staff and get a flavor of the program. And then that would be the way that they would get to know who you are. You would get ranked, you would rank, the match would occur, everyone would go about their day. That's traditionally what had happened. The problem with that is that testing in and of itself is inherently flawed. And I've always said that an exam does not necessarily define someone's ability to take care of patients, and it doesn't define their emotional intelligence, and it doesn't define, um, you know, who you are as a person. And I think we got into that trap with, if you were assigned like a certain number based on your step one score, I had colleagues of mine when I was in school like that didn't feel that they were worthy enough based on whatever score that they got. And that's not how we should be. We shouldn't be eating our young as physicians. I mean, we're supposed to be helping people, we're not supposed to be hurting our own people, right?
Right.
And so the concept of holistic review has come up as a means to say, what type of physician do I want in my residency program? And what type of doctors am I trying to train in my residency program? What do I mean by that? The holistic review affords benefits not only to a program, but also to an applicant. So, what do I mean by that? Holistic review for a program allows itself to really do a deep dive into what a program's core values are. What type of physician are you wanting to train? What do you want to get across to your trainees throughout the continuum of your curriculum? So if you're in internal medicine, it's a 3-year residency. If you're an OB/GYN, it's a 4-year residency. If you're in neurosurgery, that's 7 years. I couldn't do that, but God bless those that do. Um, and it also really says to programs, what are the types of physicians that I want to graduate into practice after training? So I think holistic review allows programs to really sit with themselves and really look around and say, are we training physicians just to the medicine? Like, are we just really talking about pathophysiology? But that's fine. But patients aren't just a list of symptoms and diagnoses and treatment plans and all that. Patients are actual flesh and blood human beings that come to you in your office in a variety of care settings and a variety of psychological states. And so you're going to have to deal with the whole person in order to construct those treatment plans and those management plans, right? And so if I was going to the doctor's office, I would want to know that my physician doesn't just see me as like a set of biometric parameters, right? I want to know that I can able to talk with my physician conversationally. My physician is able to relate to me. My physician understands my lived experience, and my physician is able to integrate all that information with whatever is going on with me such that I can be optimally fixed. So that's from a program perspective. A candidate's perspective from a holistic review allows a candidate to really think about what type of training environment do I want to go into, and what are my core values as a student that I want to really be accentuated and um, made better in training. Whether that is someone that is really focused on social justice, someone that is really focused on understanding how, the pathophys of medicine interacts with the social determinants of health. Am I going to train in a program that is aligned with my ideals? And so what Holistic Review does is allows a program to see candidates beyond a set of numbers, beyond a set of like publications, things like that, really gets to hone in on who a person is and are they someone that will be aligned with my program's values. And so I think Holistic Review is a really good opportunity to really say, you know, are we really training physicians in whatever program you're in that is reflective of our patient population, that is going to serve our patients' needs effectively, whatever those needs are? And so I think in a world where we have lots of healthcare disparities, we have increasing maternal mortality issues, we have definite access to care issues nationally. Holistic review is not just something that is, in this like academics nebulous sphere. I think it's something that is highly tangible and necessary given the state of American healthcare.
Sure. And that's a great overview from a program level perspective and that of the candidate as well. And if you think about exactly what you said, what makes for good patient care or a good, trainee, if you reverse engineer that from the qualities that you mentioned, it in no universe goes back to a great test score. What makes a good doctor or what makes a good provider, a good teammate is so detached from a score on one single test.
Mhm.
Yet for, prior generations of trainees, that was the ultimate barometer of where you could go, what you could go into. And so this really seems like it addresses a lot of the shortcomings, or at least highlights the core values of what we would all hope, or in a particular program would hope to be um, traits that our trainees embody.
And I'll just give you an example. So my intern class had 7 people, including myself. One of my intern classmates got 2 or 3 standard deviations above the mean on step one, like something ridiculous, right? That colleague of mine was dismissed from training about 6 months into intern year because they weren't able to really take care of patients. Like they weren't able to relate to them or function clinically or do the necessary tasks that an intern should be able to do. So just, it just underscores that. And like you said, a number does not define your ability to be a doctor. It's all the different components that go into what we do on a daily basis. Like we're not just sitting at our desks, like, pipetting and think and like looking at numbers and labs that come back and making decisions. We're actually really relating to people and getting to understand where they're coming from and having people have a shared decision making process in their own healthcare. Like I tell people all the time, I'm just here to make recommendations. You are the one that has to live with the consequences of whatever you choose. And we need to ensure that there are physicians that are affording patients their ability to make their own decisions, but also see these patients as human beings.
Right. And when you shared that anecdote, I just thought about some of the skills required for step one, like coming up with ridiculous acronyms or remembering some
Mhm.
minutia in some crazy way. And I think that it's just laughably
Mhm.
far from what you described as, you know, pitfalls of, sort of holding that to be the standard of what we should take into account when admitting residents, which is like this test score versus all the other things um, that matter more. And so, I think we could chat about this, all day. For the for the folks listening who may have a little bit of resistance to taking on, essentially a new way of looking at applications, interviewing applicants, thinking about training in general,
Mhm.
um, are there any advantages to kind of the older framework of, thinking about the step one, step two, these like critical single value scores, and using that as the gateway? Or is there anything that, you would challenge those people to think about beyond, or in addition to what we have
Yeah.
discussed so far?
No, that's an interesting question. So I think the advantage of what we used to do is that it's much easier to, triage who we're going to interview and who we're not going to interview,
Yeah.
right? So, some programs use specific or have used specific cutoffs for step one. And you get the chop and programs are just going to look at, those applicants that exceed that threshold. Now, because step one now is pass fail, there is this, shall we say, evaluation creep. What do I mean by that? Step two is still quantitatively graded, right? And so there are some places that are saying, well, now I don't have step one scores, that's pass fail. And now I've got most medical schools are moving towards a pass fail curriculum. What am I going to use to evaluate if I should be interviewing an applicant or not?
Hmm.
So some may argue that having those numeric scores is going to afford a program director the ability to really say who should and shouldn't be interviewed or reviewed initially, right? But I think we need to take a step back. There are so many people that are going to make wonderful physicians that may not be the best test takers, right?
Yeah.
Um, And this is really underscored in also if someone doesn't have the resources or the time to dedicate to taking or passing these exams and getting like an exceedingly high score, then you're at a disadvantage.
Right.
I see that particularly in historically minoritized individuals who may not have resources to study for these exams. And I think of not just step one, but I also think, let's go back earlier. I think of the MCAT. I think of the SAT, ACT, right? All of these consequential examinations that we say, well, if you don't reach this score, then basically you're not going to be able to do this with your life. I think that's really, really silly and really does a disservice to all of us, irrespective of what your background is. And so I would argue that holistic review is that opportunity to really impose equity on the process that we traditionally call the residency match. Equity in terms of everyone gets evaluated in the same way, with the same rubric, based on a common set of values established by the program, but a candidate is able to think about what their values are and can look and see what a program's values are and see if they are aligned. The candidate can then apply to specific programs that are most aligned with their values and that are and then that applicant's going to be more globally seen and reviewed. I'll take OBGYN for example. So OBGYN has definitely led the way in holistic review, and I'm really proud of that as a specialty. We have something called the Alignment Check Index, which is basically a really nice tool for an applicant to plug in what they really want out of a residency program. And it also allows a program to say, what do we stand for as a program? And what are we going to weight in terms of our training? Do we weight community service, work experience, background stuff, academics? What are we going to weight in terms of looking at applicants for our program? And so this allows applicants to apply to those programs that are going to be most aligned with their values. And so they have a much lower chance of leaving once they are in residency. And also not just leaving, but actually once they're in residency, thriving and graduating successfully onto a successful career in what they want to do. So I would argue that holistic review actually makes, in the end, everyone's life easier in terms of getting the doctors that you want, having the residents that succeed that you want, and having a curriculum that excels.
Yeah, that's a great point about so much being determined by, things that can be traced, whether it's the MCAT or ACT or SAT, and it becomes a smaller and smaller group that, reliably has access to taking tests multiple times or the
Mhm.
preps, courses or whatever it is. And I mean, it's a disservice to medicine if you think about it logically, if you're limiting the number of people that can potentially demonstrate that they can be excellent providers, inherently you're limiting the quality of care down the line. So,
Mhm.
uh,
Mhm.
now, moving more practically, Omar, or Dr. Young, I should say, the, for the individual interviewer who's listening to this, say they're in a program that hasn't yet adopted this, hasn't yet kind of outlined their core values as a program, things they're looking for. They've
Mhm.
got one or two interview days left, and they really want to try to implement this. Is
Mhm.
this something that an interviewer can kind of go rogue and do on their own when the program hasn't adopted it? Or how would you, on the individual interviewer level, kind of recommend somebody take this on for themselves for, the next interview, but maybe the next interview season with their program?
Yeah. I think at the interview level, it may be a little late because you've got your set of applicants that you are interviewing already. But I think the interview is a two-way street, right? You, as a program, are really making sure that potential residents into your program or fellows, if you're a fellowship program, you're not going to admit someone that is, shall we say, less than ideal for your program, um, or someone that's really not going to excel, or someone that hasn't met minimum criteria for your program, whatever that is. But I think as an interviewer, it's a really good opportunity to really do um, a cursory dive into someone as a person.
Hmm.
In the business world, when people are interviewing, they use lots of behavioral interview type questions. And I think, we're catching up in that in medicine. But I think the use of behavioral interviewing is a really interesting way to see exactly how someone's brain works, how they respond to conflict, how they deal with adversity, and how they are able to integrate complexities of situations. So I think asking those types of questions are going to be really key to seeing exactly if someone is, you know, the next Einstein and you want them in your program, or someone is thanks for playing, but we're gonna pass. Um, you may not find that by just reading someone's application. I've been in experiences many times where I'm ready to go. I'm reading someone's application. I'm like, this is going to be a great interview. Then I ask a question about that has nothing to do with the specialty. Um, and then they give me some weird answer that really gives me insight into who you might be as a person. And I always have to ask myself, is this the type of person that I would want to have call me in the middle of the night? Or do I want to stay up with him in the middle of the night? If I get any sort of feelings about that, then I'm going to have to really pass on that applicant, because I want to know that I'm going to have people in my program that are really understanding of, you know, the culture of what it means to be a physician, as we had spoken earlier. So I think as an interviewer, you can use those tools to really hone in and as to are there any red flags for this individual, um, or not. Now, conversely, we can't forget about the interviewee. Because I always tell when I do interviews, I always say the interview is a two-way street, right? The program is not just interviewing you, you also are interviewing the program. And so I would say to those trainees that are listening to this podcast or watching us, you should be interviewing your programs too. And you can apply this to any like job interview. You should be prepared to ask questions about the culture, about their values, about how people relate to each other, because that's going to also give you insight into, hey, is this some type of place where I would want to contribute my skills or not? And so I think using those tools, both from both angles, is going to be beneficial to all parties.
Right. And for the program director or APD who's thinking about implementing this, you kind of alluded earlier to the importance of generating core values for, your residents or fellows. How do you move towards that? Is that something you just get some program leadership in one room and hammer it out on a Zoom call, or how do you sort of recommend people develop these essential tenets for what they want
Yeah, I think
to
that,
represent?
yeah, I know. I think that's an excellent question. And it's not really that easy to answer. Um, s- the easy way to do this, in my opinion, and take this as you will, is really just doing like a medical education retreat and sitting down with your core team. You can involve your chair if you want. But sitting and also probably not a bad idea to involve some current residents in your program or fellows, whatever, and sitting down and saying, who are we as a program? All programs have to do an ACGME survey, which is coming up in a couple months. And it's a really good opportunity to get like a 360 view of who you are as a program. Now, am I saying use that opportunity to really understand exactly how to do a holistic review? No. But I'm saying sitting down as a program in like a retreat style setting may afford you the opportunity to really examine the opportunities, the threats, the strengths, and the weaknesses that a program may have. And you as a program leader may find some information that you aren't really haven't been privy to. And you as a trainee may better understand exactly why things happen as the way that they are because they are going to be contributing to you being the best physician as possible. So I think all parties working together for this common purpose is going to really contribute to making that value statement and allowing future applicants to have the best information possible. Probably also not a bad idea to really create a position statement or a mission statement. A mission statement being like maybe like a couple sentences or like one small paragraph that can be plastered on your website or on social media. Who are you as a program? Applicants today really use Instagram, TikTok, Facebook to a lesser extent, to really look at what programs are, because that's basically the open house that we have now in the era of virtual interviewing. And, putting that mission statement out there with a video or updating your websites, because if I'm applying to a program, I want to see exactly what this program looks like, right? And showcasing exactly the types of people that are there. What is your patient population? Where do you practice? Why are your clinics set up the way that they are? What is the common goal that we're all doing clinically, educationally, in the scholarship realm? What are we doing? And so I think all of that is contributes to not just a better selection of candidates, but just a better culture as a whole.
That's great. Yeah. And I think that, just hearing that sort of start to finish of that gives a couple of really actionable, points. One being, you mentioned sort of the concept of this retreat. Obviously it doesn't have to necessarily be that, but at least some sort of protected space, maybe physically, maybe, time-wise, where people aren't looking at their pager or in basket, don't have to go to their next case or clinic patient, where people can take the time to be reflective and be intentional about identifying what is important to them as individual providers, but for their teams and their institution. I think moving that forward to things that are really accessible and forward facing, whether that be a social media platform or communicating with prospective trainees, I think are both really important points as people develop these ideas, but also find ways to make that clear to both people who are applying and people in the program, because it can certainly be reinforcing to understand why we're all here. What is our mission statement? What are the things we hold most true to why we do what we do and how we do it?
Yeah, I think it's super important. As medicine is becoming, at certain specialties, becoming more competitive, we need to really hone down and say, now that all these traditional metrics are gone, and I think they're gone for a really good reason, right? Because once you're in medical school, we should be really focusing on acquiring that information that's going to really help patients, right? We shouldn't be really like competing and we in like this culture, this American culture, we're so driven and saying like, I need the A, I need this certain like high mark because I need to know that I'm better than you and that's going to give me advantage over this and da 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 da. But at the end of the day, didn't you go to medical school to take care of patients? I'm sorry, but getting an A on a microbiology test isn't really gonna matter when the patient in front of you is septic and you don't know how to treat their sepsis. So I think we really need to step back and as a collective and say, who are we and who do we want us, aka the future physicians, to be?
Well, that's terrific. And I think that's a great place. We're running up against the clock here to sort of close things out. I think this has been an awesome conversation about what holistic review is, where it really came from, what to be thinking about for the individual interviewer, but more importantly, the program level as hopefully more folks adopt this. Typically, we end our episodes with the med-ed moment. I think I'll just do mine unless Dr. Young, you'd like to join in after, but
You are the host today.
I would say one of the things that came across through multiple parts of our conversation was the intentionality of identifying your core values. And I think those things can be very anchoring to, who you want in your program and, how you do things. And I think those things can be good items to revisit over time, whether if you set some goal or some ideal for your program that you understand changes over time. It gives you a little bit of traction to understand where you've been and how you've grown. And that's important for, I think, people in the department or in the division, but also trainees to see that this is a group that's adaptable and can understand their blind spots or have grown and really expanded beyond the goal that they initially had or the principle they had. So my meta takeaway is write your mission statement for yourself, for your department, for your division, and see how that falls in line with the folks around you, because putting that together can be really powerful for your program. So any closing remarks or thoughts, Dr. Young, before we let the folks go?
No, I think you said it all. This was great. I hope you, the listener, and you, the viewer, if you're watching, really do take away the things that we talked about today, because this is one of the really important things that we as medical educators have to do is, not just training the next generation, but getting them into training. And so really think about what we said today, and yeah, I'm proud of where we're going as a community.
Absolutely. All right. Until next time.
Bye.